Welcome to MedTalks, your go-to source for health information and medical insights. I'm your host, Juvenava, and we are bringing you the latest in healthcare. Whether you're looking to understand the basics of wellness, gain practical tips for everyday health, or learn about community resources available to help you live a healthier and happier life, MedTalks has you covered. Join us on this journey to better health, and remember, a healthier you starts with a single conversation. Stay informed, stay healthy with MedTalks, where every talk is a step towards a better you.
Grace Med Health Clinic is your home for complete compassionate care. From medical visits to vision screenings, dental care, behavioral health support, and a fully equipped pharmacy, we're here to meet all your health needs. Our dedicated team of providers and staff work together to make every visit welcoming and stress-free. Because at Grace Med, you're not just a patient, you're part of our family. Call 316-866-2000 to schedule your appointment. Grace Med Health Clinic, compassionate care for all.
Welcome back, guys, to another episode of MedTalks. I am here with a friend of mine, Amber of Cairn Health. Amber and I have worked on a couple of collaborative meetings and stuff like that. Cairn Health is a great friend of Grace Med.
Yes,
and so I wanted to get this opportunity to talk to you, to get to know more about you and Cairn Health, and so that our listeners can get to know more about Cairn Health. So,
excellent.
Amber, thank you so much for being here.
We're very excited to be here.
Thank you. Tell us a little bit about yourself.
Well, my name is Amber Beck, and I'm the executive director for Cairn Health. I have been in nonprofit 14 years, and I spent working with children. I've worked with domestic violence survivors, and now I'm in the healthcare industry.
Awesome. Can you tell us a little bit more about Cairn Health?
Sure. So Cairn Health has been around 88 years.
Wow.
We're getting ready to come up on 89 in January. It's pretty exciting to have such a long-standing organization like this. And we haven't really changed. We want to help individuals get access to their medication. We want to help them get access to glasses and diabetic supplies.
What need did you see that our community had or needs that's the reason why Cairn Health exists?
Well, as you know, over this last year that I've worked for Cairn Health, I've really noticed that the cost of medicine continues to go up, and the cost of insurance doesn't seem to meet that need. Right. And so we're really seeing that gap of being able to have insurance or have no insurance for a lot of individuals, and being able to pay for their meds. And then with the glasses, 61% of individuals in the United States live in blurry vision. And that truly breaks my heart that something so simple could have such a big impact on somebody's life. Right. I mean, driving, eating, anything you do, not being able to see is, just a challenge. Yeah. And so, helping somebody get a pair of glasses, and just, it's like, if you ever watch those videos where they're putting glasses on babies and be like, it's amazing. That's what it's like when we be able to help somebody who hasn't had a pair of glasses or they lost them for a long time. Right. This year, Cairn Health has almost paid for 1,200 pairs of glasses for the Wichita community.
That is awesome. That is so cool. We basically serve the same patient population.
Correct, you do.
Uninsured, underserved individuals. Right. What challenges do our patients go through in order to get medications or to even get glasses?
A lot of it's just navigation. I don't know how many people call me just for the glasses piece and go, well, do you have insurance? Well, I have health insurance. And I'm like, did you know that your health insurance will cover your eye exam? They're like, I didn't know that. Yeah. I've been walking around for so long with blurry vision, and I could have gotten an eye exam with my health insurance. And so just educating somebody about what their health insurance actually has. Yeah. And then for those individuals who don't have health insurance, helping them navigate, like, where can they go to get an eye exam? And for a reasonable price, or for, depending on where you're looking, if they don't have any money, where can we get them their eye exam? And then Cairn Health can come in the background and help them cover their glasses.
Now, how do they hear about you? Is that like a referral process?
So we have 109 case managers throughout Sedgwick County that we work with.
Wow.
And with that being said, there's over 40 agencies that refer clients to Cairn Health.
Okay.
And so we send out monthly, sometimes it's a quarterly thing that we send out that say, hey, funding's changed, or we have extra funding in this area. We try to keep everybody up to go what we're doing.
Yeah.
And then they can also follow us on social media. Everybody has social media these days. It's hard to keep up with all of the different social medias.
Oh, yeah.
I mean, look at all of what we have to do to connect with people. And so, just trying to figure out where all those areas are and how to best communicate with the clients that we serve.
How many partners do you have? So other organizations or other agencies that you work with?
So there's 40 that refer to us.
Okay.
We have 9 different locations for vision assistance here in Sedgwick County. We also have services in Reno County, Harvey County, and El Dorado.
Oh, wow. Wow, y'all are serving a lot of communities.
Yep, we're growing. Yes,
that's awesome. Back in the day, I was in a collaborative group, and that's the first time I ever heard of Cairn Health.
Best kept secret in Wichita.
Yes, best kept secret, and for a lot of it was because our homeless patients couldn't get medication or couldn't afford medication. How does the funding source work for each program that you're involved in? So
what's really challenging about Cairn Health is that nobody knows that we're helping them a lot of times because their case managers referring them. And so, like we get referrals from you guys or we get referrals from Ascension and nobody knows that it's coming from us, which is a challenge sometimes, but how they get to us, they get through us through referrals, they can self-refer. And then funding wise, we have a wide range of funding sources that we have available to clients, and it changes every year. So you have to apply once a year to get access. So seniors in this, I'm talking about Sedgwick County, receive $180 a year in assistance for medication. So if we're coming behind insurance and copays, that's a pretty good amount that we can help them a couple of times. For individuals with disability or have a disability case, they receive $50. And that's not going to change in 2025. We get funding from the Sedgwick County Department of Aging. And so we know what that funding is going to be for 2025. And then everybody else it's a $30 spending, which now that the cost of medication continues to go up, that doesn't help out a lot. Which is, really unfortunate that we're in that position now. And we don't want people to be non-compliant because they can't afford their meds. But we know that happens. And so, we were trying to find a better way to serve those uninsured patients. So that's what we're doing.
So like you said, cost is on the rise for medication.
It's only going to go up again.
Right.
Yes.
Exactly. And those funds are limited. So what happens to those patients who run out of the money and still need that stuff?
So 2025 is going to be a different game change. For patients that are uninsured or underinsured, Cairn Health is opening a pharmacy. So we're opening a community pharmacy. And what that means is that the medication that comes out of our pharmacy is free. So we'll do a dispensing fee. So if I can get, say you're on 4 different medications, and if I can get all those synced up to where I'm going to dispense to you 90-day increments, so that means I'm going to dispense to you 4 times a year. So that client is only going to pay $40 a year for their medication. Which is reasonable. I mean, for how much it's going to cost otherwise,
of course.
And they won't be able to use the drawdown. They will have to pay that $40 to get their medications, and we're going to ship them. It's a challenge with the homeless population because I can't ship to a non-address. There's lots of laws and rules. I don't know if anybody's been in healthcare, but there's so many rules that they look at you and go, you can't do that. Okay, great. Cool. Let me find a new way. I would like to break the system. So that's what happens.
I think you're not the only one.
I know. I know I'm not the only one that wants to break the system. So for those individuals who are homeless, we can have a designated drop-off area.
Okay.
At a community partner. It can be at a case manager. It can be some of those areas where the client has deemed that they would like the medication to be delivered to.
Yeah.
And that's how you deliver to the homeless population.
Awesome. Very cool. That's wonderful work.
Yeah.
That's really awesome. One of the things that we always deal with our patient population is they think that they can qualify for insurance, for Medicaid. And so we have to talk to them about Kansas not expanding Medicaid.
Right.
And
Right.
why they can't just get insurance with the state. And so we have to talk about like the advocacy work that we do on our end.
Sure.
Can you talk about the advocacy work that you do on your end?
So we're fighting the same fight.
Yeah.
That good old fight.
Yes.
We're all part of, talking about expanding Medicaid. It's not going to be a fix all.
Right.
But we talk about, how do we help parents? What is it? Because we know that when your kids get insurance, if you're a married couple, you don't.
Yeah.
Right. So, they're banking on one of you being healthy. And so how do we help with, those areas? And so we're always, advocating at state level. We're having those conversations about expanding Medicaid, and, really for us, it's about advocating for the client. Hey, have you talked to your doctor about switching you to a different medication? Here's a list of some other meds that might work, or, have you tried this? What frustrates me about the system, about trying to figure everything out and trying to navigate, is, and this is another reason why we're opening the pharmacy, is because we're looking at uninsured patients. Well, their med may be cheaper at 3 different pharmacies. And so they're going to 3 different pharmacies to get their meds at the best rate.
Yeah.
Which we don't blame them. I mean, our money only goes so far. So sometimes that's just the way it works.
Right.
But if I can give somebody a home pharmacy that wouldn't necessarily have one, that's our intention. So that way, when we're looking at those 3 medications, we know that those 3 medications aren't going to interact.
Yeah.
Right? By having them picked up at one location. That's what the pharmacist does.
Yeah.
And that's what your pharmacist does.
Right.
We're looking at all
Exactly.
those medications,
Yes.
and so we're looking at how we can best serve and make it the easiest for the client. We want to break down barriers. So healthcare is not the last option that an individual chooses to take care of.
Yeah. One of the other things too that we deal with is the lack of education or knowledge that people have on how to use their insurance, or even where to get the resources, things like that.
Have you read it? It's a book. I mean, it's fantastic. I read it, and it was a good night read. No, make you go to sleep at night. No, but it's a book.
Yeah.
And what people don't realize is if you have state insurance, there's so many benefits.
Yes.
I mean, getting, discounts for your kids to play sports, getting $50 gift cards to go to the farmer's market.
Yeah.
I'm like, I would like these benefits. I would go to the farmer's market. That's great.
Seriously.
If you have bed bugs, they'll help you with treatment of that. I spent a lot of time looking at these. They have rent assistance. They do have to go to another agent, a nonprofit.
Yeah.
But if you're behind on your rent, you can get like $2,000 from your insurance. You can get rides to appointments.
Yes.
You just got to plan.
Yeah.
I mean, let's plan. Let's
Right.
be serious about that. But some of it is just teaching the client to advocate for themselves. Have you talked to your doctor about this?
Agree.
Well, no.
Right.
Great. Go have that conversation and then come back and let's talk.
Yeah. We call it from like coverage to care. So like now they got coverage. Okay. What does this look like?
What does it look like?
And we also have to deal with it when we assist individuals with the ACA, because they don't get it. Healthcare is such a complex thing.
I told you, it's a book.
Yes, it's such a book.
Right.
And people have a hard time understanding it. I mean, I have a hard time understanding it too.
Right.
Like everything changes every year. And so you're having to learn. And now Healthy Blues being added on to
Absolutely.
Medicaid. It's like, we got to learn them too now.
Right. Because, and that's so frustrating, and especially for, us who are in healthcare trying to help these individuals, go, hey, did you know?
Right.
No, I didn't know. Well, did you read your book that they gave you?
Yeah.
I mean, and that's just, I think that's a question that we ask often is, what kind of insurance do you have? Let's have a conversation about it. Everybody in my office is community healthcare workers. We're all certified community healthcare workers, including myself. And so we, want to provide those, education parts to the clients that we serve. And, but it takes time.
Right. Right. What is the vision for Cairn Health in the next 5 years or 10 years?
That's a loaded question.
I know.
Wow. Okay. So our community pharmacy, obviously it's launching in January of 2025, and it is going statewide. So we will be able to ship medications to the uninsured individuals, and we're focusing on Western Kansas, Eastern Kansas, and then of course this central region.
A lot of rural communities.
A lot of rural communities, right?
That's
Where
awesome.
they don't have access to 340B like we have here.
Right.
There's 21 FQHCs here in Wichita, the most in the state here in Wichita, which I think is great.
Right.
In Western Kansas, there's 2. Eastern Kansas is a little better, but we know that there's massive gaps, and so we know that we can do something about those. And especially with our process is all digital, nobody actually has to ever come see us. I mean, they can if they want to. We're a lot of fun, but nobody actually. Our application is text or emailed. So we're looking at that. We're also looking at vision care. Those are the things Cairn Health cares about is meds and vision. And so we're looking at how we maybe make a mobile eye doctor office to go into rural. Again, we're looking at rural because the services are here.
Right.
We have them here.
Yes.
We have great opportunities for clients to get access to healthcare if they so choose.
Right.
Where we're, struggling and, the hospitals are struggling because we have all of these areas that these rural communities where their hospitals are shutting down or they're limiting the services that they have. So what's happening is they're coming here to Wichita, which is great, and we can help them while they're here. But what happens when they go home? How can we help somebody when they're back home get their meds? And so that's why the pharmacy is a delivery system and focusing on those rural areas. And that's why the vision is also focusing on those rural areas. That's what the benefit of being around 88 years. We have the services here that is needed. Now we need to figure out how we can add those services to other areas that need our assistance.
Well, and I think a lot of people don't understand how much of a healthcare desert Kansas is in general. And
very much
how even for some of our patients who live in Wichita, we're having to send them for specialists
to Kansas
City.
Right.
And that's a drive. And you're having to miss work and you're having to all this and plan things out. I mean, the need is definitely out there, especially in rural communities. I think what I heard recently is that McPherson lost their only pharmacy, which was Walgreens during the shutdown. And
1,800 Walgreens are shutting down over the course of 2 years, I believe. It's just really, truly a God thing to push me into the pharmacy world. That I never thought I would be opening a pharmacy. But after we made the decision to open the pharmacy and do that, all of these other things kind of came into play that we're like, we're really thankful that we're going to be able to have this opportunity. This community pharmacy is not new to the United States. It is new to this area. And so, there's probably, I'd say it's been a trend in the last 3 years. I have not met a community pharmacy that's been open more than 3 years. And, we're working with one in Branson. There's one in Kansas City area called Pharmacy of Grace. Nobody ships, but, I want to ship. I think that's a limit, access, kind of a barrier wall breaker. And so those are just kind of the things that we're looking at. And there's other ones throughout the United States, but those are the ones that we kind of modeled and looked after.
I think it's incredible what just Wichita is doing, even in Kansas. What we're doing as community health providers on how we want to just evolve and grow and meet the needs of the community. So I think it's wonderful. I think you're doing wonderful work. So I really appreciate you stopping by and talking to me about this stuff. Is there anything that perhaps I didn't get to mention or ask you that you'd be interested or wanting to let our listeners know?
Sure. We want to make sure that, everybody learns to advocate for themselves. I know we talked a lot about that, but I'm really big into advocating for yourself and putting that as at the forefront of your mind as, how can I advocate for myself or how can I advocate for my loved one in the healthcare world?
How can people support you or support the organization?
I'm always looking for money. I'm like the money lady. People see me coming and go, oh, here she comes. She's going to ask me for money. I sure am. You
Yeah,
got any money?
right.
No. So, we're always looking for that. But, we're also looking for partners. Who wants to come along this with us on this journey? If you're not a referring agency, how do you become one? You just need to call my office and talk with us and become a referring agency. Train your staff to know how to, send referrals to us so that way it's in the best interest of the client. And it's just really about, that continual one conversation that everybody's having about healthcare.
Yeah. Awesome. Well, thank you so much, Amber.
Yeah.
Greatly appreciate it. Thank you guys for listening to another episode of MedTalks, and catch you next time.